students' weekly COVID-19 testing cadence will return to one test per week. All of these collective efforts and your support of one another have truly made an incredible difference. Even with the positive developments on fast-tracking the distribution of vaccines, an effort in which Ohio State is playing a significant role, it is imperative that we stay vigilant and keep up with the public health protocols that have gotten us this far, wearing masks, physically distancing, and washing your hands. Beginning this week, in partnership with the state, we are dedicating a portion of the Wexner Medical Center's first dose vaccine allocation to any Ohio State student, faculty, or staff member. Overall, we've administered more than 150,000 total doses to individuals living and working throughout Columbus and the state. That's 8 times the seating capacity of the Schottenstein Center and bigger than the shoe. And our Buckeye community is stepping up, as you always do. We're so encouraged that approximately 40% of the university community has already scheduled or had at least one shot. Getting as many Buckeyes as possible vaccinated is a key part of our plans for a reactivated in-person fall semester. I urge everyone who is eligible to sign up for and receive a vaccine as soon as possible. In these last few weeks of the semester, we're especially encouraged that our students are getting vaccinated before they leave campus. We're grateful for our partnership with the state of Ohio to be able to offer students the one-shot Johnson & Johnson vaccine. So let's get out there and get vaccinated, Buckeyes. Last week, we shared some of our fall semester planning with the university community. Students have already begun scheduling classes for fall, and at least 75% of classes are designated to be taught in person. With more of us vaccinated, we will also expect to have more flexibility about group sizes, space density, and other protocols when we come together for events, programs, informal gatherings, our sports competitions, and other celebrations. We're also continuing to plan for our spring commencements. 2 ceremonies are scheduled to be held on May 9th. These will be the first in-person graduation ceremonies we've been able to hold since 2019. Though they have been modified to ensure everyone can participate safely in light of ongoing COVID-19 concerns. Students who are graduating and planning to attend one of the in-person commencement ceremonies will be required to show a green status on their daily health check app upon entry, which means you will need to schedule and complete a test during the week of Monday, May 3rd through Friday, May 7th. Coming together to recognize our graduates in person is one of the best rewards for all the safe and healthy guidelines throughout our academic year. And now, please allow me to introduce our speakers for tonight's town hall. Dr. Hal Paz, Executive Vice President and Chancellor for Health Affairs and the Chief Executive Officer of the Wexner Medical Center, will provide an update on the state of the virus, including information on variants of concern. Next, Dr. Andy Thomas, Senior Associate Vice President for Health Sciences and Chief Clinical Officer at the Wexner Medical Center, will give a vaccination update and share information about our vaccine allocations to date. We'll then hear from the Executive Vice President and Provost, Bruce McPheron, Senior Vice President for Student Life, Melissa Shivers, and Senior Advisor and Interim Senior Vice President for Talent, Culture, and Human Resources, Paul Patton. We'll also have time for questions, which will again be moderated by Dr. Teresa Long, former Columbus Public Health Commissioner and Special Advisor on Community Engagement to the College of Public Health. And we're so pleased that once again, Dr. Amy Fairchild, Dean of the College of Public Health, and Dr. Peter Moeller, Chief Scientific Officer of the Wexner Medical Center, are also available to answer questions. And Dr. Moeller and Dr. Thomas will also be answering questions throughout the chat function this evening. So thank you again for being here tonight. And now I'll turn the program over to Dr. Paz.
Well, thank you, President Johnson, and good evening to everyone. We're meeting virtually again, but as President Johnson just highlighted, we're making great strides towards a time when we can begin taking steps safely to come together once again. And much of the credit goes to all of you for your continued diligence that you've shown in adhering to the health and safety protocols that we know protect all of those around us. And I want to thank you for all of that. But while we're all feeling hopeful about the progress we're making, we're not yet at the finish line. COVID-19 cases in Ohio have increased over the past 4 to 6 weeks. The 7-day rolling average of cases has increased from between 1,500 to 1,600 cases per day, approximately 30 days ago to an average of over 2,000 cases per day now. And while this is a concerning trend, the rate of increase across Ohio is still far less than the 8,000 to 10,000 cases per day that we were averaging back in December. We're also keeping a close eye on COVID-19 trends nationwide. For comparison, in Michigan, currently they're averaging about 7,000 cases per day over the last 7 days, which is up from 2,600 cases per day approximately 30 days ago. Also, in the state of Pennsylvania, new cases per day have increased from a 7-day average of 2,500 per day to over 4,000 per day over the course of the last 30 days. COVID-19 hospitalizations in Ohio are also elevated compared to 4 to 6 weeks ago. As of today, Ohio had a statewide COVID-19 census of 1,236 patients in the hospital, which has increased from a low of 839 patients less than 3 weeks ago. That's more than a 45% increase over the past 3 weeks. Back in mid-December, the statewide hospital census peaked at over 5,000, so the current census levels certainly pale in comparison. But these trends also underscore how important it is that we not let our guard down at this critical moment. In order to continue taking advantage of opportunities like safely coming together for an in-person commencement, even with limited seating, we must remain vigilant. Getting vaccinated is an important step, but we also still have to rely on the same health and safety protocols that have been in place throughout this pandemic to ensure we avoid a trajectory of cases like Michigan is currently experiencing. We have some of the most brilliant scientific and medical minds right here at Ohio State, and because of that, we know there is a simple way that we can save lives. Just wear a mask. The science is clear. Masks lower the risk of COVID-19 infection by as much as 80%, and that truly means lives saved. And we can prevent even more deaths by also practicing physical distancing and washing your hands regularly. That becomes even more important as we consider the variants of the SARS-CoV-2 virus that causes COVID-19. As is expected with a virus like this and many other viruses, the genetics of the virus is mutating. Since the beginning of the pandemic, Ohio State Wexner Medical Center has been utilizing next-generation sequencing to monitor the evolution of the virus across populations in Ohio. This is a powerful technique that specifically identifies the genetic information of the virus to look for specific mutations or variants in the viral DNA that may be a cause for concern. We look for these variants as we first want to make sure that our diagnostic tests are not impacted. To date, because of the design of our testing strategy, none of the viral strains have impacted the quality or accuracy of our testing. We also look for variants to determine whether they might be more infectious or might have a greater impact on treatments. To ensure our best line of sight into this situation, we've increased sequencing efforts. Based on samples that are generally sequenced by our own in-house lab at the Wexner Medical Center, as well as a handful of labs around Ohio, we are seeing increased percentages of confirmed cases with genetic variation. And while some of these new variants appear to make the virus more contagious, the variants do not appear to increase the risk of hospitalization or death as compared to the original COVID-2 strain. To be clear, mutations were expected, and this in itself should not be cause for alarm. The genetic variation of the virus has not changed how the virus is transmitted from one person to another. That still happens when respiratory droplets from the mouth or nose come into contact with another person. The vaccines we use are also still highly effective against most of the variants identified in the US. That is yet another reason why it is so incredibly important to get vaccinated as soon as you're able. Of course, as President Johnson mentioned, the Wexner Medical Center is dedicating a portion of our first dose vaccine allocation to all university students, faculty, and staff members. And you can find more details on how to schedule an appointment at the shot on the Wexner Medical Center website. So before I turn it over to Andy Thomas to provide a more in-depth vaccination update, I'd like to close by saying how grateful I am to everyone who has made it possible for us to reach this extraordinary milestone of 150,000 total vaccines administered. To continue that momentum and to keep up with the number of appointments being scheduled at this shot, we need additional support for both clinical and non-clinical roles. Undergraduate and graduate students, as well as exempt faculty and staff across the university, are eligible to assist. More details about eligibility and how to sign up are available on the Safe and Healthy Buckeyes website. I'll close by saying thank you once again. I'm enormously grateful to all of you for doing your part to keep yourself and each other as safe and healthy as possible. And now I'll turn it over to Andy Thomas. Andy?
Thank you, Dr. Paz. I really want to thank everyone for joining this evening. If you could pull the slides up, please. Thank you. For those of you who joined after Dr. Paz started his remarks earlier, I just want to take a second and reemphasize the point that he made about the increasing case numbers across the state of Ohio and across other states in the Midwest. What we're seeing here is the blue vertical bars are the cases, new cases of COVID-19 reported each day. And the blue line across the bars is the 7-day rolling average of those new cases. In the state of Ohio, we have seen an increase over the past 30 days from about that 1,500 to 1,600 cases per day up to over 2,000 cases on average per day just with today's data. Even in Franklin County, we're seeing a similar slow but steady increase over the last 30 days. Next slide, please. What we're really trying to avoid are these two curves. These are the state of Michigan on the left and the state of Pennsylvania on the right, where they've seen significant increases just in the past 30 days from about 2,500 cases per day to over 7,000 cases per day in the state of Michigan. And similarly, from just over 2,000 cases per day 30 days ago to over 4,000 cases per day now in the state of Pennsylvania. Vigilance around masking, distancing, avoiding large crowds where people aren't masked and you can't control your environment is going to be incredibly important to make sure that our data does not track like our two neighbor states' data is doing. But obviously, being vaccinated is a really key and critical part of that. Next slide, please. The state of Ohio has had a lot of success with our vaccine campaign. Last week, the state passed over 4 million individuals in the state that have received their first dose of the COVID-19 vaccine. But what's most important is the red box. That shows our individuals in the state of Ohio over age 65. And this past week, we crossed the threshold of having over 70% of those individuals over age 65 vaccinated in the state of Ohio. Those are the individuals at highest risk of severe disease, pneumonia, or death, and also hospitalization. So having those folks protected as early as possible was an important part of the state's strategy. However, when you look at those younger age groups at the top, ages 20 to 29, 30 to 39, a lot of those age groups, includes many of the folks watching tonight, have just become eligible in the past 2 weeks. We're looking forward to a partnership with the rest of the university campus to make sure we're doing our part to get those vaccine uptake numbers up. Next slide. Just to remind you, we'll talk in a second about the Wexner Medical Center sites, but it is important to remember that there are over 1,200 vaccine locations active in the state of Ohio, and in Franklin County alone, over 110 locations. Local public health departments, retail pharmacies, hospital vaccine programs, as well as some doctors' offices all have the COVID-19 vaccine. So if you aren't getting it through a Wexner Medical Center location, that's completely fine. But there are a lot of opportunities and locations around the state where you can get the vaccine. Next slide. Briefly to talk about the COVID-19 vaccine program here at the Wexner Medical Center. As you've heard, we've had amazing success. The 150,000 total doses last week was outstanding. In fact, just today, probably right about right now, we are crossing 100,000 first doses that we've provided through the Wexner Medical Center to both members of the public as well as our university community since mid-December. It's an amazing accomplishment. As you can see at the bottom, those are our total number of doses per day for all of our sites at both East Hospital as well as the Schottenstein Center. And we're routinely on our weekdays when we run 3 4-hour vaccine sessions, we're getting over 3,000 doses administered per day. It's just been a terrific partnership with the athletic department. I cannot thank Gene Smith and Zen Riggs, Colin and Scott from the Schottenstein Center team. They've just been outstanding partners with this initiative. And we really want to thank those in the university community that are volunteering their time to come over and help as well. Next slide. So here's where we are with the university community vaccine uptake. In the red circle there, you can see the percent vaccine uptake through Saturday's vaccination sessions for those individuals who have either signed up, actually on the schedule to get their first dose, or who have already received their first dose. To think that we are already at 40% of the university community, including over a third of our students and over a quarter of our non-Wexner Medical Center staff already in the process of getting vaccinated is really outstanding. It's over 50% of our way towards that 70% number that people are targeting around the concept of herd immunity. So we're very excited that this week we're actually opening dedicated appointments to our own faculty and staff, just like we've been doing with students for the last 2 weeks. At this point, there are over 2,500 vaccine appointments available for faculty and staff between Wednesday of this week and Tuesday of next week, and over 4,000 appointments remaining for students. Next slide. Please, to schedule, go to your MyChart account. If you don't have access to MyChart or don't have a MyChart account, feel free to call the 614-688-VAX, 614-688-8299. It's our vaccine hotline that can get you directly to a scheduler during work business hours during the day to get scheduled for your vaccine. But if you have a MyChart account, go in to select an appointment. You'll see all of the different appointment options available to you over the next week to get your vaccine scheduled. And we'll be continuing to open more appointments in weeks to come. If for some reason you go in and there are no appointments left for this week, there is, as you see on the Wexner Medical site, the far right-hand box with the red arrow is a Get Notified box. If you click on Sign Up, you enter your information and either a cell phone or an email, and you'll be contacted when additional appointments are opened. With that, I want to thank you all for your commitment to getting vaccinated. Thank you all for your help with the vaccine sites, and thanks for keeping us all safe and healthy. And I'll turn things over to Bruce McPheron to move forward with the presentation.
Thanks, Andy, and good evening, everybody. Let me just highlight a few things for us this evening, along with my colleagues, Dr. Shivers and Mr. Patton. As President Johnson noted, we're enthusiastically preparing for an autumn semester where our classrooms, labs, and studios are full of life. We're about halfway through the course scheduling process for students who are currently on campus, and new first-year freshmen and transfer students will be scheduling their courses during orientation, starting in late May and running through the middle of the summer. With more students taking classes in person, we've set up a tiered approach so that smaller classes can take place in rooms that are at a full density, while the largest classes will have reduced capacity so that students can find space among themselves. Some of the large classes with more than 100 students will be offered online, but we know that some of these are gateway courses that enroll a lot of first and second year students. So to accommodate teaching in person where possible, our largest rooms will be capped at 50% of their normal capacity for some of those courses. We're continually evaluating vaccination rates and health data to better understand the health measures that will continue to fall. But we already know that masks are likely to be required indoors, including in classes. If vaccination rates are high enough and positivity rates are low enough, we hope we can go without masks for outdoor classes and activities. President Johnson noted that at least 75% of courses will be offered in person, but we'll have to wait until summer at least before we know what the full schedule looks like for the average student. Our early numbers do show the impact of this change in perspective. In the past fall, autumn of 20, and the current semester, spring of 21, only about 2% of our students had course schedules where 100% of their courses were in person. Already, as we plan for autumn 21, that number has flipped. Currently, only 2% of the students who scheduled courses for next autumn have all of their courses online. So we're seeing the effects of our changed schedule opportunities. I'm sure Dr. Shivers will talk more about the student experience outside the classroom, so I'll just leave you with one additional thought. And it really highlights what Dr. Johnson, Dr. Paz, and Dr. Thomas have said. We'll continue to take all health measures necessary this fall based on the evidence and science available at the time, that we know that vaccination will play a big role in all of our decisions. We expect measures like masks and testing to be part of our safety protocols, but each of us can make the campus more safe for one another by getting vaccinated. Both inside the classroom and outside, we'll have more flexibility if our community has high numbers of vaccinated individuals. I encourage everyone who can, students, faculty, and staff, to sign up for shots as soon as possible. Dr. Shivers?
Thanks, Provost McPheron. And I just want to take a moment to also thank everyone, especially our students. What I've witnessed and watched you do this past year has been nothing short of incredible. You have taken on a task that has been difficult really for everyone, but certainly you all joined our Ohio State community and you committed to what we needed for you to do for us to have a successful academic year. So it really does warm my heart. And I know all of my colleagues here on this call and around the institution to see that we're just 2 short weeks away from the end of an academic year and you all will be going into your finals. And we've been able to be here at Ohio State in person for the most part. And that is, quite frankly, in part due to your tremendous efforts and commitment to keep yourself and other Buckeyes safe. So thank you so much for everything that you've done to get us to this day, and to all the folks that have been working across our community in helping to keep every single one of us safe this year. As has been made very clear throughout the session, the higher levels of vaccination we can attain, the more opportunities our campus will have to return to what we keep calling and what I refer to as the next normal. At our last town hall, I talked a lot about the iconic Ohio State experience and our aspirations to be able to deliver on that promise in a more fulsome way. And just as we've been saying over the past year, we will need to still stay together as Buckeyes and use that approach and ensure that all of the health and safety protocols that are in place are followed both on and off campus. We're getting a lot of questions about how the residential experience will be. We are planning for greater density in the residence halls, which means that we'll be able to have a more vibrant and active residential community with many more opportunities for students to come together, both formally and informally. We are currently working on recommendations related to the residence halls and visitors. I heard a lot this past year about the importance of being able to have friends to visit from other residence halls. But unfortunately, just with regard to the virus, we didn't feel like that was the best decision for us to make this year. But certainly, we've heard you, students, and I completely understand. So we'll continue to evaluate that and be able to make some decisions in the coming weeks. We will indeed, though, make our decisions in concert with our public health partners, just to ensure that we are maintaining a strong balance of opportunities for engagement with strategies that also keep people safe. We do expect that we will have less of a need for quarantine and isolation spaces, which will enable us to reactivate entire buildings that had to be held throughout this academic year, which is yet another reason that it will be so important for students to take advantage of vaccination opportunities. In terms of the dining experience, one of the most asked questions in advance of this evening's program has been, what will the dining experience be like? Once again, students, we've heard you pretty loud and clear, and recognize that the great work that we've been able to do over this past year by utilizing our Grubhub system and the fact that students were able to place an order and come and pick up, what we recognize is that doesn't necessarily replace the importance and the significance of being able to sit down with one another and to build community in that way. We have indeed found that many students really do enjoy the mobile ordering option, and we were doing that well ahead of the pandemic. And I imagine that we will continue to offer that as an option for so many of our students. We will indeed try to maintain that level of delivery and service through our mobile ordering. Having said that, just like with the programs, events, and activities, the pandemic has significantly impacted the community building opportunities that are truly inherent, as I mentioned earlier, within the dining experience that is so important to the overall student experience. So I hear from a lot of students and from their parents that they are tired of eating in their residence hall rooms or on the go. So as the higher vaccination levels are achieved, we hope to be able to bring back more of our seating and gathering options. Believe it or not, the dining experience is actually a tool that student affairs professionals across the country that we use to initiate and sustain student engagement, which leads to retention and student success. From a food variety and customization standpoint, we've also been testing out how we can safely provide self-service options. Even in the Ohio Union, we brought back the self-serve salad bar, soup, and hot food options. I heard from many students loud and clear that you want to be able to count the number of cucumbers or be able to determine how many onions you want or don't want on your salad. So we are so thrilled that we're able to provide that level of option and choice to you before the end of the academic year. I've actually had the opportunity to use it myself, and it feels wonderful and incredibly safe. We do ask that users make sure that they are sanitizing their hands and putting plastic gloves on before entering. And of course, that masks continue to be required. The bottom line is I think we will maintain some of the efficiencies that we've put in place and things that we've been able to achieve during the pandemic, but we will also be in a much better position to offer more variety and the very important student engagement opportunities that I know you all are looking for. In terms of events, gatherings, and programming, without question, at least once a week, I'm getting questions about when can we get back together, Dr. Shivers? I know a couple of you still tell me that I'm the VP of no fun, but I'm working really hard to try to provide more opportunities while also making sure that we keep our community safe. I have been very focused and supportive of making sure that we have opportunities for students to be engaged. And I also recognize how difficult it has been this entire academic year for groups and organizations to not be able to meet in person. And I, again, am just so grateful for your sacrifice and understanding why we couldn't do those things in person. Yet I want you to know that we also understand the importance of the in-person engagement and will work really hard to help us to get back to that. In student life units across the country, we talk about and utilize the mantra of getting involved. It's the way that we know students are able to get connected and feel engaged in the community that they've chosen to live in. We know that students who are engaged have higher retention rates, that they persist to graduation at higher levels, they connect with the university in more meaningful ways, and they actually self-report higher levels of success in a variety of ways, whether that's their grades or attaining personal and professional development goals. Next year, we are laser focused on bringing back both formal and informal ways for students to get involved and get engaged. Will there still be elements of physical distancing and other safety precautions? I expect so. And we may not be able to do everything that we've done in the past right away. But I can promise you that the opportunities will be so much more robust, and I simply cannot wait to join our students at events and programs that haven't been possible in the past year. I, like many of you, joined the institution shortly before COVID hit. And so those things that you all have missed, I've also missed too. So I am eager and excited to share in those experiences along with you when we return in the autumn. We do want to make sure, though, for many of our students, they have benefited greatly from having the opportunity to attend and participate in virtual events. I've heard from many students that they've said, you know, I've always wanted to attend this event or that event, but I could never make it to Columbus. I live on a regional campus, and so I couldn't make it to Columbus. So being able to provide programs virtually has really opened up the door for us to create more accessible programs, to be able to have more students that would historically not have been engaged to be able to do so. So what I hope that you'll see in the fall is an opportunity to have those in-person engagement opportunities, to sit down alongside someone else and have a conversation, and for us to still be able to provide that virtual access for those that would like to be engaged, perhaps in a more informal way. So really excited about what that has looked like and will look like for us going forward. As always, if you have any ideas or suggestions, please feel free to reach out to share them. We really are still in this together as Buckeyes, and I cannot wait to see what we're going to be able to do next year. Now, I'd like to turn it over to my colleague, Paul Patton.
Thank you, Dr. Shivers. And hopefully by now, as the last presenter, you've seen a lot of enthusiasm, progress, and excitement from my colleagues, well-deserved because of the hard work that's going on in this organization. I too want to add my thanks to the faculty, the staff, and the employees of this university who have kept us open and who have kept the academic mission alive and well. You've done so with personal and professional sacrifice, and you've done so with the ability to be flexible and pivot at a moment's notice during what we all identify as one of the most serious crises of our nation. So let me add my personal thanks to you for continuing to be an outstanding group of talented individuals keeping the academic mission alive. I want to talk about the return to campus work groups. The overall aim of our campus reactivation planning is to offer safe and more robust in-person experiences this fall to our faculty, staff, students, patients, and visitors. We also recognize there's an opportunity to look at our policies and practices and add more flexibility for how work gets done. There have been 4 work groups established to prepare recommendations on these very topics. They are flexible work, benefits and leave, benchmarking and continuing to have discussions with our peer institutions, and of course, the change management and communication process, which is just as important as the decision. We don't want anyone to think that we will flip a switch one day and ask everyone to come back to work the next. This involves a lot of planning and it involves a lot of process. By the end of April, these work groups will have completed their initial recommendation and many of the related deliverables. I want to talk a little bit about the philosophy that's going to drive these recommendations. First, Ohio State faculty and staff are a vital part of supporting the mission of the university and the in-person experience of students, patients, and visitors. We are becoming increasingly innovative in the ways we serve our constituents to support our mission. Flexible work is a recruitment and retention tool to inspire a modern, high productive workforce, which benefits both employees as well as colleges and units. If we have flexibility, we can offer enhanced mental and physical well-being of our employees, support work-life balance, enhance retention of highly skilled staff and faculty, allow for business continuity during emergency circumstances, reduce absenteeism, improve productivity, and many other benefits. I do want to spend a little bit of time on the enhanced mental and physical well-being of our employees, because not everyone feels the same way about returning to campus. Some are very anxious, some are very excited. It is important to let your supervisor or other thought leaders in our organization to understand your particular issues and your particular needs to see if those needs can be accommodated. We also acknowledge that not all roles lend themselves to flexible work arrangements to the same extent, and we need to invest in the well-being and other benefits often associated with flexible work to the extent possible. The pandemic experience shows that flexible work can offer new ways of working in many positions. And upon returning to campus, we could see a significant portion of the workforce able to execute their duties using some kind of a flexible work arrangement. We intend to identify several possible work options, which are still under development. Broadly speaking, they will fall into categories of location flexibility and scheduling flexibility. Most importantly, we will provide job aids, training, and toolkits for managers on how to evaluate flexible work requests and supervise remote employees. In short, our 4 work groups will identify recommendations and toolkits for those individuals who need these type of arrangements. Also, benefits and leave, we will recommend continuing to evaluate COVID-related accommodation requests for employees and their medical conditions as a standard risk for HR processes. We know everyone has been working hard over the past year because we see the positive results of those efforts. With that in mind, we want to replace return to work language with return to campus. Return to work or back to work unintentionally implies remote employees have not been working over the past year, and we know that is simply not true. Returning to campus is just as much of a behavior change as the sudden shift to remote work was last year. This will impact employees who have remained on campus, those returning to campus, and those who will continue to work remotely. To help with that adjustment, we will create a common transition approach combined with a cohesive, people-first communication strategy. With that, I would like to turn it over to Dr. Teresa Long, who, as you all well know, has successfully moderated our past town hall meetings. Dr. Long?
Better unmute myself. Thank you so much, Mr. Patton, and good evening, everyone. It's really great to be with you all, and I'm so glad you all are here tonight. Thanks to each of our speakers for all this information. You've really packed a lot in. And also, again, for being here and being willing to take questions, because there are lots that are coming through. So again, thank you so much for all that you've shared. And again, we do appreciate all the questions. Actually, we got many, many questions in advance. So we're going to be answering those and others as they are coming in. So we're going to get to as many as possible. So I'm going to start off with a few that cover a wide range of topics, of things that were of interest to multiple people and who submitted questions. But also, and if you haven't noticed already, you can feel free to ask those questions that you're not hearing come up in the Q&A, and Dr. Thomas, Dr. Moeller, and student life representatives are also working on answering those vaccination and many other related questions in that Q&A function real time. So thank you for doing that. So with that, let's just get to it. And actually, President Johnson, I'm going to ask you to step up on the very first question. We are getting lots of people asking this. And I don't see Dr. Johnson yet, but hopefully she's there. There she is. Hi there.
Hi.
Johnson. So will students, faculty, staff, and/or staff, will any of those groups be required to get vaccine?
Well, thank you very much, Dr. Long. And the simple answer is no, we will not require it. However, we will strongly encourage to get the vaccine. And it's just one way that we can ensure that we get to herd immunity sooner and get back to the next normal, as Dr. Shivers said in her presentation. So, I mean, that's really the long and the short of it. Please get vaccinated as soon as possible and help us all return to a fall in person with all that means.
So thanks for the clear answer, Dr. Johnson, because that question has been flying around. We both had it before, but we've had quite a few of those. So thank you for the clarity on that. That's really helpful. And absolutely, we want everyone who's eligible to get vaccinated. So with that, let me turn to you, Mr. Patton, Paul. other questions that have been coming in, again, both ahead of time, but also right now, which you just started talking about, but I'm going to keep pushing here, is will there be options available to continue working from home? And what might those be like?
I think it is absolutely imperative that we have options. And we're also still very much mindful that we have to monitor data on a daily basis and a weekly basis, and we have to be able to pivot. So we are not out of the pandemic yet. We are making tremendous progress. As Dr. Thomas indicated, just look to the left and look to the right of Ohio and see that those two states are experiencing a surge up. So we want to be mindful of that as well and make sure that all of our plans for employees remain flexible.
I really appreciate that. Yes, absolutely. Maintaining our flexibility and being as thoughtful and smart. I know that you're working with work groups on that. So thanks so much for that. Well, and Dr. Paz, I have a question, or others have a question for you. And that really is taking us back to what you mentioned as far as variants. So can you speak a little bit more about those variants of concern and what do they really mean for the pandemic? And some questions in the chat, is that what's going on in Michigan? Is that what's going on in other places? But again, the broad question is about the variants of concern and what it means for the pandemic.
Yeah, thank you, Teresa. Well, we know that viruses mutate, and this is nothing new, nothing surprising. And not infrequently, when viruses mutate, they actually become more contagious. Hopefully, they become less lethal in the process, but there's never that guarantee. There are multiple variants. We are studying them and learning as much as we can in different parts of the country. But the bottom line is nothing about these variants changes our strategy. Our strategy has to remain the same, which is to wear a mask, to physically distant, to wash hands, and to do everything possible to get vaccinated as quickly as possible. That's what we have to do. We need to understand the variants. These are important questions. We believe that they certainly do have a role. We've seen that in other countries where variants such as in the UK and in Brazil have developed, and there have been real changes in terms of the contagiousness of the virus. And sometimes we are concerned also the possibility of its lethality. But right now, our focus is really on understanding what we need to do to protect everyone. And the SARS-CoV-2 virus is the same SARS-CoV-2 virus in terms of how we respond to it as we've had all along.
Sounds great. I really appreciate that. I know there's a lot of concern about what it means. We hear a lot about it in the news and what it means for me. So I think you've done a nice job of explaining that. Thanks. So sticking with how vaccines are rolling out, Dr. Thomas, you're up next because they're continue, and you hit a lot of this information in your presentation, but what is it that the university is doing to assist students, faculty, and staff? You kind of hit that, but could you hit that again? And then I have a couple of brief follow-ups as well.
Certainly. Thanks for the question, Teresa. I think for faculty, staff, and students, I would say the vast majority of those individuals have both the chart in EPIC, which is the electronic medical record for the medical center, and hopefully by now have developed a MyChart account. That's where they can get the records of their tests that they've had done. That's where they can, if they are a patient of a medical center provider, they can request refills and communicate with their providers. But it's also a way that they can go in and schedule appointments. Frankly, also just to remind people, not just for appointments for the COVID vaccine, you can schedule sports medicine appointments, all sorts of things through MyChart. So the MyChart account, and there's a link off the COVID vaccine webpage for the Wexner Medical Center. If you don't have a MyChart account, you can sign up for one of those electronically online. And then there's also a phone line, 614-688-VAX, which allows people to call during business hours and talk to a scheduler and get scheduled. In addition, we're doing a lot of outreach in the community beyond our own university community to those folks who don't have good connections into the healthcare system. We've been working with a number of community-facing groups focusing on different minority populations as well as immigrant populations, people that do not have English proficiency, to try and make sure that they're finding a way to get scheduled. We're sending people out into the community to community organizations and community centers to get people scheduled. In fact, our East vaccine site is set aside for only residents that live in 11 different zip codes around the city, both on the near east side, near south side, and up the Cleveland Avenue corridor, where there is less access to healthcare in those neighborhoods of the city. We've worked with Columbus Health Department to identify those zip codes and are really preserving that space located on the near east side for patients to access. They can also obviously go to the Schottenstein Center as well, but we know that a lot of those patients that have difficulty with accessing the healthcare system also have transportation needs and other things. So we are working also with some community organizations that are facilitating transportation for patients. So it's really been a wide approach looking at our patients, our university community, as well as parts of our Central Ohio community that frankly just don't have the access to healthcare that we wish they had. And we're trying to do our best to try and overcome some of those issues.
Thanks, Andy. You know, I know that Dr. Thomas, I know that that's been, of course, a huge effort of the university, and both you and your colleagues should be super proud of working to bring in everyone we can to the system. So vulnerable persons who may not have easy transportation, easy access to healthcare. So thank you all.
I want to just take a second and thank Dr. Fairchild and her faculty for what they've been doing on this issue. Dr. Paz and I have met with a number of the College of Public Health faculty, and I know we've been trying to get them in front of leaders from Columbus Public Health, Franklin County Public Health, as well as the Ohio Department of Health, because we have a lot of knowledge inside the university around both vaccine hesitancy as well as differential rates of vaccination in different communities, and making sure that we are doing all we can as not just a hospital or a medical center for the university, but as an academic platform to share our knowledge and best practices with public policy decision makers across the state.
Well, thanks. And I've heard it's going well. So Andy, one more question to just stick with you that's come up again and again in the chat, and maybe you've already responded to it, but there are many on the call tonight, or not call, on our presentation town hall forum that are wondering if they've gotten the vaccine someplace else, how can they submit that information if they want to? I'm one of them. Right.
I'll take a crack at that. And if anyone else from the leadership team wants to chime in, that would be terrific too. For the data that I presented, what we are doing at the Wexner Medical Center through our EPIC electronic medical record, we are able to query data out of the Ohio Department of Health's vaccine database to pull in data. If someone's gotten vaccinated at a retail pharmacy or a health department, that's all submitted to the state. And we were able to, with matching demographics and date of birth, et cetera, to pull that data back into our system. However, that data doesn't go anywhere. That your electronic medical record is sacrosanct for you as an individual. We don't share that information with HR or with the Student Life or the registrar's office or on an individual basis. The data that I presented tonight, though, does include, in terms of those percentages, as well as the ends of people that have been vaccinated, it does include those who have been vaccinated outside the university. But at this point, I'll leave it to others on the university side to talk about how they're collecting that data. Because we also know we have incoming students that are going to be first-year students in the fall. And those are people that live all over the country, all over the world, frankly, right now, that'll be vaccinated, hopefully between now and fall semester. We're going to have to collect that data in some other means. I don't know, Dr. Shivers, I don't know if that's something you can comment on, or I know that's something I think the IT folks are working on.
Thanks, Dr. Thomas. Yeah, they are. We're working on figuring out a way to be able to allow for our new students and those that are currently here to be able to report back to us if they've been vaccinated, because we know that many of them would love to have that on their record that they have been vaccinated. So more information hopefully to come soon about that.
That's great. And thanks, Dr. Shivers and Dr. Thomas, because I know there's a lot of interest in being able to do that, because we want to both show that we're participating, but we want to be able to look at those numbers that we've talked about as far as trying to get to that herd immunity. So for many of us who've gone to other providers, if there's a self-report mechanism, that might be something that we want to be sure to let people know about when that makes sense. And obviously Student Life is working on it, but that is likely true for employees and faculty as well, staff and faculty. Okay, so thanks very much. And actually, I'm going to just stop and interject because there are so many questions coming through. I want to be sure that that everyone here knows that we will be sharing all of this information with everyone, just as we have after the last town halls. Ohio State will post these frequently asked questions by topic on the Safe and Healthy Buckeye website. And also we'll share, just like we did the last time, when the link to this actual program is available, will be sent to you through your on-campus newsletters. And again, that will be as soon as the link is available. And I know some people have been asking about getting access to this presentation afterwards. So very good. We look forward to that. So on to some other questions that are coming up. I think I've got two coming for you, Dr. Fairchild. So these are for Dr. Amy Fairchild. So Amy, yes, there you are. Hi. So, and again, this is around student life and campus life. I guess it's more than students because it's all of us. It's campus life. So can you speak a bit about the question, the key question that keeps coming up is, will people still have to wear masks in the fall?
Thank you, Dr. Long. Well, I'm gonna date myself just a little bit. I keep thinking about that Indigo Girls song, "Closer to Fine." Anytime I think about the fall, we are going to be closer to fine in the fall. We're closer to fine now. If you think about the vaccination rates, we are going to have more people on campus, more activities, more fun. Even the dean of quarantine doesn't think that OSU should be the place where fun comes to die. But we need to be safe. And so safety measures, while we're doing all of this other stuff, we're going to be relaxing in other ways. Safety measures are going to need to be in place in the fall. And we do expect to require masks, particularly indoors. Now, if we can achieve a high enough vaccination rate and we can keep COVID-19 rates on campus low, and we're not having any other worries about some of the variants of concern that Dr. Paz and Dr. Thomas have talked about, we hope to be able to remove that outdoor mask requirement really, really quickly. And as you heard before, a lot of that's going to depend on getting some of the vaccine data. If we can link vaccinations to testing, to patterns on campus, the more we know, the more we can begin to loosen some of these restrictions. And our goal is to loosen as fast as we possibly can.
Great. So thank you. And again, we all need to be flexible and smart. We know what's going on in Michigan. We know what's going on in Pennsylvania. We're still in this. So thank you for that. So let me ask you another question. And it's been alluded to, but I think since you're kind of providing a lot of the leadership and oversight, or at least lifting that up to the president and the executive staff, the question that keeps coming, or that has been asked multiple times, is, will students who are vaccinated still have to get tested in the fall? So really both about testing and then about what is the vaccination status? How does that impact?
Sure. So when you think about testing, I would think in two ways. So testing on the one hand is about giving us the data to give us a picture of how well we're controlling transmission on campus. But it's also a key mitigation strategy. So as we're thinking about students who have been vaccinated, what we really need to know is that, in fact, in a congregate setting, vaccinations are having the kind of effect that we expect them to have, and that we're not seeing a lot of breakthrough transmission. So by testing students who have been vaccinated at a reduced cadence, and right now we're thinking about once a month based based on the formulas that we've come up with. The higher we can get those vaccination rates, the longer we can give between the times that vaccinated students will need to be tested. But we're looking at once a month now, while unvaccinated students and their vaccination will really be about mitigation. Unvaccinated students, testing will be about mitigation. Unvaccinated students will need to be tested, continuing at a cadence of once a week. But the other benefit of vaccination is, even though there will be some testing at a much reduced level, it also is going to have an impact on what has to happen with quarantine. So students who are fully vaccinated won't have to quarantine in the fall, and that will be a different experience for students than we had this past year.
Wow, that's really helpful to think through. So thank you for that, Amy. That's really helpful. So, and actually, there are a couple of questions going on around vaccine, and I've just been seeing more of them. But I'm going to start, and actually, maybe first, I'm going to go to, I think probably to you, Dr. Thomas, Andy. This question about how long a vaccine lasts. We had that ahead of time, and then we've had it come up again. But get ready, you and Dr. Paz, Dr. Fairchild, there's more coming up too.
Yeah, thank you, Dr. Long. I think it's a little too early to say definitively. Some data that was just released over the past week is certainly now putting that at a minimum 6 months. If you would have asked me this question 2 months ago, I would have said at a minimum 90 days, because that's what the CDC had released. I think each month we go forward, we know more for those first people that just got vaccinated in clinical trials last summer. At this point, they're saying 6 months. I think what is more likely to be the case is that at some point, if the virus mutates enough, there may need to be boosters that cover slightly the different variants over time. Right now, as Dr. Paz mentioned, we're seeing still a very effective response to the vaccine in terms of the variants, but that may be something that a booster dose, either annually or if they have to change the formula, similar to what happens with flu shots each year, may be the case moving forward. But I think it's way too early to say for sure. But at this point, all that's been really announced by the CDC is they believe it is a 6 month, at a minimum, 6 month immunity. I don't know, Dr. Paz, I don't know if you have anything else, or Dr. Moeller.
Well, I would say this, you're absolutely right, Andy, and there's still a lot to learn. We're trying to understand the impact of antibodies that are created by the vaccine, but also cellular immunity, our other immune system, and how that can fight off the virus. Compared to the influenza vaccine, which last year was about 45% effective, this is extraordinary, and we're very optimistic that the kind of effectiveness we've seen with all three of the vaccines will not last a few months, but could last much longer. We just don't know how long, and so to be on the safe side, there's going to be a lot of testing done and a lot more clinical research being done to understand how long the effect will last.
Right. That's really helpful, and we'll obviously learn more as we go along. So just as you both said, so thank you for that. So here's a question, and actually maybe I'll toss it because we haven't had Dr. Moeller on. But the question, but again, it could go to you, Andy, or to you, Dr. Paz. There's questions going on about the safety, feeling unsure about getting the vaccine. So could you share a little bit about what we know about the safety of these products to kind of help people if they're still questioning, on the fence, and unsure about the safety, especially being a new product?
Sure. So maybe I can start, and then I can hand it over to my other colleagues. So I think the first is, before dose one went into an arm in the United States, thousands and thousands, tens of thousands of people were tested with very rigorous protocols, and that data was peer reviewed by a list of very highly esteemed panelists before it moved forward. We've continued to learn over time of the safety and efficacy of these vaccines over the last few months. And in fact, just this past week, we've learned even more data in terms of safety for, whether it's a 12 to 15-year-old in some early studies, as well as for breastfeeding or pregnant mothers. So we continue to see this. I would say, as scientists and as medical professionals, we're always very skeptical and want to take a very hard look at any data before we, believe it. But for the 3 EUA approved vaccines to date that are being put in arms here in Ohio, we feel very good about this. But as we've heard from all of our experts on the call tonight, we want to continue to be vigilant in our research. That's one of the great things about Ohio State is that, we have a lab in real time and we're continuing to look at these every day, and we will be incredibly transparent if we see anything that we need to make folks aware of.
That's great. Thanks, Dr. Moeller. And I don't know, Andy, Dr. Thomas, Dr. Paz, do you want to add anything to that?
Yeah, I'd be happy to add. I think we've found the vaccine to be very safe here at Ohio State, but I think what's especially rewarding to hear is from the CDC's perspective, there have now been over 160 million doses of this vaccine that have been given in the United States. Certainly, there are side effects that many people get from the vaccine. The most common being pain at the injection site that may last for 24 to 48 hours. And with the second dose of the 2-dose vaccines, you have a slightly higher percentage chance of some other side effects in terms of a low-grade fever or some body aches. What that really means is the vaccine is doing its job. It's tricking the body's immune system into making the antibodies and having the response, not as if you were affected because you're not infected, but it's tricking the body into making those antibodies and preparing to fight the actual virus in the future. So you're not infected, but it's just those are side effects of the body's immune system kicking in to create those antibodies in that memory so that it can fight the virus if it does come into contact with it in the future. In essence, that means that the vaccine is doing its job. So those symptoms tend to last anywhere from 12 to 24 hours. They tend to be easily treated with Tylenol or ibuprofen. It's part of what we see with a lot of vaccines, but really it's a good sign that means your immune system's kicking in. So the vaccines in general, from an anaphylaxis or severe reaction, the CDC reports it's in the single digits per million doses that people are having, severe anaphylactic reactions. That's a far better rate of risk than if you get COVID, even if you're young and otherwise healthy, in terms of your risk of severe disease or death from COVID. So we found them to be quite safe with only minor side effects that are really time limited and self-limited. Now, Dr. Paz, anything to add?
I would just add that, historically it took around 10 years to develop a new vaccine. And most recently for some of the childhood infections, the record was 4 years. So what occurred in this country is nothing short of extraordinary. At the same time, I think the FDA appropriately wanted to be cautious and provide emergency use authorization as opposed to final approval for the vaccine. And that means it leaves open the opportunity to collect additional information and data. But their record in improving just these 3, which, as Andy said, have had some incredible performance based on all the data we have now, and have not been subject to some of the concerns we've heard about with other vaccines, I think speaks volumes about the decision-making process. I know that many of us that know a little bit about this and a lot about this were more than happy to line up when our time came to get vaccinated, and we couldn't wait, actually. And I would encourage any of my patients, any of my family members, any of my friends to get vaccinated.
Well, I really appreciate that. And I know I too was excited to get mine. And I was actually, many people may not know that we're all invited to participate in some citizen science and getting information back to CDC via text. And, every day for the first week, I got a text of how was I doing? And then every week. So there's a lot of information that's coming in about the safety of these vaccines, and they really do look very good. So thank you. Thank you for that. So a next line of questions, but really I'll pull it into one. I'm going to first pitch to Dr. McPheron, to Bruce, and then to Dr. Fairchild. And it really is about how we study the data and the science and how we plan at Ohio State to adjust to what we're learning and what we're seeing. So there are a number of people that are wondering, will we be loosening restrictions as things obviously are getting better? Or conversely, will we actually be adding restrictions if they start to turn for the worse?
Teresa, it's a terrific question, and what a great segue to have just talked about the safety of the vaccines, because what you heard from our medical doctors was that, in fact, we're watching the data very, very carefully. The same has been true for over a year now as we've watched the knowledge base emerge on COVID around the world. And in fact, the work that we have done here at Ohio State has contributed to that. The fact that we instituted a robust testing process, the QI responses that we made. Those who are thinking back to the autumn will remember us making a pivot at Thanksgiving time in the decision process of whether we were going to stay live for those last few days. That was evidence-based. That was actually looking at the campus positivity rates. And, we continue to put the data first in our thinking in protecting the Buckeye community and our surrounding Columbus and other campus communities. We are asking our undergraduate students to test twice weekly. That was not a random decision. That was a decision based on the evidence of our own campus. We have allowed our graduate and professional students to return to once a week testing, and that was based on understanding positivity rates. Our use of masks, our use of hand hygiene, physical distancing have all been evidence-based. We look not only at what we're learning, we look at the literature, we look at the best ideas of peers and how to implement various public health responses. We look at the local, state, federal, and international guidance for continued evidence. Amy, what would you elaborate here?
Oh, I would punctuate some of the themes you laid out. I think of it as one of the things we need to do is kind of stay tuned in to the virus, both looking at some of those big trends, those big changes in guidelines and how they can guide our policy, but looking at our particular context, because context always matters. So context has a lot of different dimensions. The part of the context is what we learn about vaccine safety and efficacy, but then part of the context is our own local situation, what's happening in Franklin County, what's happening in Columbus, what's happening in Michigan that can give us some cause for being very, very cautious. So when we make adjustments on campus, we're always trying to stay in tune with what we're seeing. Are we seeing a bump in cases? Where are we seeing it? Are we seeing an increase in variants of concern? And does that make us want to change our testing protocol? Does that make us need to think about targeting testing in some populations or subgroups on campus? You've seen it already. We can tighten, we can loosen. We're already, the Safe Campus Group is already going to be recommending some measures to relax some things in the fall. For instance, there has been a change in evidence about cleaning protocols. So, if you're worried about wearing a mask, the cleaning protocols might not be the top of your mind. But that makes a big difference if you're thinking about bringing the numbers of people back to campus that we're thinking about. But the number one priority for all of us is to make sure that we're getting this balance right, as we're balancing education as a public good with the protocols that we need to make sure that we deliver a public good in a way that's consistent with public health. And that's something we're always going to do. We're going to continue to hew to the evidence, both the broad evidence, but also our very local contextual evidence. And that's not just for the Columbus campus, that's also for the regional campuses. That's something we look at on a daily basis, just like we look at the data that we see for this city.
Well, Dr. McPheron, Dr. Fairchild, I know that this is an everyday thing, and you have just shared a lot of information there that's super helpful to those who have, and we all continue to wonder, how is it going to be, and will we have to get a little tighter, or will we be able to loosen up and continue on? So thank you both for that information. And actually, let me say, we have come to the close of quite an amazing evening of information. Gosh, thanks so much to all the speakers. I want to thank everyone for participating, but clearly for those who joined us and have joined us in February and March, we hope that these sessions have really been helpful to you to keep you up to date on the university's planning and the response efforts. And they have been significant. And as a reminder, I know I said it before, but Ohio State will post this video and the frequently asked questions by topic on the Safe and Healthy Buckeye website. And also we'll share that link to this actual presentation as well. So again, the presenters have been awesome. The participants have continued to be engaged and had lots of questions. So as I say goodnight, I just urge everyone who's eligible, please get vaccinated. And again, please stay safe and healthy. Have a good rest of the evening.